Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine we put together here at the Virginia Institute for Public Policy so that when you go out on your daily visitations and somebody hits you with some of the nonsense that's thrown around as factual, you have something to respond with. And please, more sugar, more flies with honey, you know what I'm saying? First up this week, and we've got a great program lined up for you from the Pacific Research Institute. The great Sally Pipes leads off this week's program. And good to hear from you, Sally. How are you doing today?
I'm well, thank you, Joe, and delighted to be able to talk to you again.
Well, and certainly I feel like at some point we're going to get to a point where we can move on to other business. But little by little, the innards of Obamacare are going away. You wrote a wonderful column about the short-term health care plans that the Trump administration has. I guess would it be a fair statement to call them re-legalized?
I think so, yes. I mean, it was last October 12th, President Trump, in one of his executive orders, announced that that the short-term insurance plans would be re-released as plans that would be renewable for just under 1 year, as opposed to during Obamacare. Under Obamacare, the time frame for having a short-term plan was reduced to 3 months, which meant that they were virtually, unusable. Nobody would purchase a plan for 3 months. But the Obama administration wanted to make the short-term plans very unattractive so that they could encourage Americans who didn't have employer-based coverage or weren't on Medicare or Medicaid to enroll in the exchange plans, either in their own state or in the state where the exchange plans were managed by healthcare.gov, the federal exchange.
And you remind us of a very important part of the Obamacare legacy. This was about forcing people to engage in commerce. At the end of the day, though wrapped in the raiments of doctors' coats and stethoscopes, this was about forcing Americans to buy something they otherwise wouldn't have bought or at a level they wouldn't have consumed it.
Right. Well, on March 23rd, 2018, not just a couple of weeks away, Obamacare will be celebrating its 8th birthday. I never thought, Joe, that this would, that Obamacare would still be alive 8 months later. There have been a lot of changes to the disastrous law and things that are making the market open up for consumers. But one of the key issues was that in June of 2012, Chief Justice of the U.S. Supreme Court, John Roberts, ruled in that case that the individual mandate was constitutional under Congress's power to tax, which was, of course, a huge blow. I never thought that was going to happen, but it did. And so Obamacare, is still alive, even though, as I said, some of the things have, gone under. But one of the exciting things is that in the tax reform bill of December, the individual mandate was repealed, and that will be effective on January 1st, 2019, which means that, Americans who are in the individual market would not have to purchase insurance or otherwise pay a penalty of $695 or 2.5% of their income. So that was a big nail in the Obamacare coffin. But we're seeing, right now that a number of states are talking about, introducing their own individual mandates, which of course will be difficult. But anyway, that was a very positive step. But as you know, a number of 20 states attorneys general from red states like Texas are saying that since the individual mandate is unconstitutional, really Obamacare is dead. So we'll see how that case filed in the federal court in Texas goes. But I hope it goes well.
Well, and going back to the short-term care plan, and I want to circle back in a little while to Virginia because in all bafflement, as Obamacare rides off into the sunset, Virginia is chasing after the buckboard saying, no, wait, can we do a Medicaid expansion too? Wait, don't do Shane. But before we get there, I want to go back to the short-term care and do some of the numbers for what you cover in your column are stunning because here in Central Virginia, Virginia, where we flag from, we have some of the highest health care insurance costs in general and increases because of our loss of choice in the health care market. Talk about what some of these short-term care policies can cost as comparison to some of the Obamacare exchange policies.
Well, I think one of the terrific things about allowing the short-term plans to be available for a year and then renewable for future years is that, the essential health benefits, the mandates under Obamacare, those 10 essential healthcare mandates will not have to be part of a short-term plan. So that will reduce the cost of coverage for many, many people. Community rating, which means that insurers can't charge sick enrollees more than they charge healthy ones, that will be eliminated. And the guaranteed issue mandate, which forces insurers to offer coverage to any willing buyer, regardless of how sick they are. Those are getting rid of community rating and guaranteed issue with the short-term plans is really a terrific move. So what we have to remember is that the proposed rule now is open for discussion for 60 days under HHS, the Department of Health and Human Services. After that point, as the new Secretary of HHS, Alex Azar, has said, hoping then that if all that goes ahead, then late summer, early fall, short-term plans will be available to individuals, many of whom are uninsured because they're between jobs, or they just didn't want to, purchase an expensive plan because they're young and they're healthy. So the short-term plans aren't for everybody, but they certainly are going to open up a portion of the market and provide options for people who, as I say, didn't want to buy an exchange plan because it was so expensive, and particularly for young people. And HHS thinks that about 100 to 200,000 Americans are going to leave their exchange coverage and purchase these short-term plans next year.
Well, I certainly can imagine that, and a reminder that we also saw a spike with these regulations on insurance policies, people who were not actually using the insurance for health care, but were actually using it to cover things that they should have perhaps paid more for if there was an insurance marketplace. And is it unfair? And I think we've talked about this in the past, Sally, as we listen to some of the hair-on-fire rhetoric regarding losing this or losing that number one fallacy is health care insurance is not health care, and that nobody in the United States can be denied care if they need health care. And the number two fallacy is that what you're looking at in the insurance market still isn't a free market of insurance companies all competing for varying levels of your interest. Are those 2 points that need to be brought back into this conversation?
Well, definitely. And I think, as you pointed out, no one in this country, and even illegal immigrants, can be denied coverage at an emergency room in a hospital or at a community hospital. And we'll talk maybe in a bit about the Medicaid expansion in Virginia.
Oh, yeah.
But certainly in the states that expanded their Medicaid programs under Obamacare, there has been a dramatic increase in ER use because a lot of the people on the expansion plans, we've added about 15 million people across the country, bringing the total in this country covered under Medicaid to 76 million people. Well, of these 76 million people, many of them are finding it difficult to get a doctor to take them as a patient, or they go on a long waiting list because the reimbursement rates for doctors treating Medicaid patients are 38 to 42% below what they get for treating a person with private coverage. And so it's no wonder that a lot of docs are not taking these patients because they're not even covering their own costs. So we've seen ER use up, and that was one of the issues that when President Obama was the president, and one of the reasons for bringing in the Affordable Care Act and supporting it so heavily was because he said emergency room use is very expensive and we need to get away from that. And under Obamacare, we will. Well, it has backfired because, as I say, by adding 76 million people to Medicaid, we have made it more difficult for these patients to get coverage. And in Oregon, they did a study between those people who were uninsured and those people that had joined the Medicaid expansion, and they looked at outcomes. And in fact, the outcomes for those who were uninsured and those on Medicaid were actually no different.
I wanted to get to that Oregon study. I'm glad you ran ahead and jumped there. I should have known you would, Sally. Sally Pipes from the Pacific Research Institute is on with us talking about great column. We'll put it up on our social media site, the short-term health care insurance plans bringing affordability back to health care insurance. That Oregon study, I think, flies in the face of a lot of the proponents, whatever their agendas may be regarding Medicaid expansion, because it belies the idea that people are dying sick in the street and are in ill condition because there's not Medicaid expansion, which has already grown to almost 30% of Virginia's discretionary budget anyway. And talk about the president has said, listen, if you do this on the state level, that's, who knew Trump was a Federalist? We didn't know that coming in. But he said,
there were a lot of things we didn't know.
This is true. But he said, listen, the states can do what they want, but the idea of these work requirements, almost reminiscent of the Clinton-era welfare reform plans, do those create a poison pill? Our governor has threatened that if that is how it's brought to his desk, he'll use his line item veto power to start carving out parts of Medicaid expansion if they were to leave it in the budget and send it there with work requirements and job training requirements and things like that. Do we have any data on how those have impacted communities, Sally?
Well, I think one of I think that Seema Verma, who is the administrator of the Centers for Medicare and Medicaid Services, was the one who, touted the work requirement rule. And as she said, I mean, it would require, if your state applied for a waiver, to include Medicaid work requirements. It would require people who are able to work. Not everybody on Medicaid, but certainly those people who were able to work. They would have to work 80 hours a month in order to qualify for Medicaid. And I think, one of the things that we've seen under this Medicaid expansion is a tremendous increase in people deciding, well, I don't really need to get a job because I can be on Medicaid, and it's better for me, and I don't want to get a job and increase my income to above 138% of the federal poverty level, because then I won't be able to be on Medicaid. Mm-hmm. And so, but the progressives and the left have just gone crazy over the idea of putting work requirements into Medicaid and for states being allowed to apply for a waiver. And Kentucky did apply for a waiver, and it was granted by the Centers for Medicare and Medicaid Services. Already lawsuits have been filed. The healthcare system, Obamacare, is imploding. It is a disaster. People could not afford the premiums. They can't afford these high deductibles on the exchange plans. And yet every time there's a discussion about making it better for the consumer, the politicians in these in the blue states are just going crazy about any changes, showing that they just want more and more people dependent upon government. And I think it's a crying shame that this country is going that way.
Well, and it's unsustainable economically, Sally. And when you look at people who were making these decisions to, if they added their welfare and their health care and everything else together, that they couldn't in their community find a job that came anywhere close to the kind of benefit that they would get, salary plus health care and things like that. There weren't those kind of jobs. They were in the $40,000 and $50,000 a year range in some states. So, of course, it's not an incentive to work. And it's really, sadly, the politicians admitting that they've driven all the jobs away and aren't particularly interested in bringing them back. And we can get into for days on the reasons for that. But I think you're right. It's that dependency that we just can't keep affording because each dollar we give becomes that much less valuable. So every time we give $1 away, the next time we have to give $1.50 away, and it's just getting bigger and bigger.
Well, absolutely. And, you mentioned Virginia and the share of the budget for Medicaid. in California, our Medicaid program is called Medi-Cal, and one-third of Californians, 13 out of 39 million Californians, are now on Medi-Cal. And, it's just destroying the attractiveness of California as a place to come. The Golden State, the gold is no longer in the Golden State, and the people that make jobs and create jobs and hire and employ people, a lot of these companies are now moving out of the state of California because of all of the the very high housing costs, poor K-12 education, high taxes to support these programs such as the Medicaid Expansion.
Well, you mentioned how many people on it. I know that in the 90s it was a cool kids comment on Medicaid that we should give everybody Medicaid for everybody, open up Medicaid to everybody, and that would be our single payer because Medicaid was so much more efficient as a health care insurance provider than your average insurance company. But that was a scale and scope issue, I always felt, and now we're starting to see that come to fruition where Medicaid participants are finding that the functioning of the, quote, insurance company behind Medicaid is as bad, if not worse, than the private insurance companies.
Right. Well, I mean, I certainly know that Alex Azar, who is the new Secretary of Health and Human Services, he's very concerned about, what the cost of Medicare and of Medicaid in particular. And he and Seema Verma are going to be working very hard to, look at new approaches to Medicaid. And in addition to the work requirements, they're also talking about a rule that would cap lifetime being on Medicaid for a lifetime. So you would cap they would cap the Medicaid money that you get over your lifetime, so that people would not be encouraged to continue. People that I'm not talking about people who are really indigent and would never be able to work again. But for those people who can work, we need to cap the lifetime amounts paid out under Medicaid, and to have, as we talked about a minute ago, about work requirements to encourage people to get back into the workforce. And of course, we've seen, with the, how when government becomes much bigger, we have higher minimum wages. We're seeing in California, Caliburger now has hired Flippy the robot to replace workers in Pasadena to flip hamburgers because, the minimum wage is so high the company cannot make money. We're going to see driverless cars and trucks. When these people lose their jobs, what are they going to be able to do because they're not trained for the high-tech industry? So there are a lot of issues here that really need to be looked at, but we need to change the mentality in this country from thinking that government is going to take care of so many more people because, as you know, government doesn't have money. They tax people like us
eventually,
to pay for these programs.
What about the other side of it? And, certainly we've seen this with the Veterans Affairs Administration of Healthcare. But I worry also as more and more states become the answer for medical insurance, when the care doesn't meet the expectations, one of the bigger driving forces in private health insurance is the cost of these of tort and the suits that are brought by family members. And I have this real fear, I know we'll report on it, that first family member that sues California or, heaven forbid, Virginia because their mom didn't get the health care they should have, and Medicaid fails this family, and now they lawyer up for a big lawsuit. And that's a sidebar that I think is just going to grow as this goes on if we don't stop it.
Right. Well, I mean, if you look at the cost of medical malpractice lawsuits in this country, Price Waterhouse has costed them out at $210 billion a year because doctors do a lot of tests normally because they are afraid of being sued. But as you say, as we expand, Medicaid and other government programs, and as you know, in many states, including California, they have a bill, SB 562, which is a complete single-payer bill. In the legislature, we've got Bernie Sanders, Medicare for All. We now have Andy Slavitt, former CMS administrator under Obama, with Medicare Extra for All. All of these things, as we're seeing this push towards, single-payer Medicare for All, government taking over our healthcare system, Americans are very litigious, and when they find out that just like Canadians who will wait today 21.2 weeks from seeing a primary care doctor to getting treatment by a specialist, I mean, that's the way it is in Canada. But when Americans, if we get a single-payer system and we develop the long lines like in England and all other countries that have single-payer, this is a litigious society, and we are going to see a lot more lawsuits when people die or they're on a long wait for care and they don't recover in the way that they thought they should and in a timely manner.
Well, I have a relative who's a Scottish citizen, and he's been treated for gout for, I think, and my wife will correct me, I think at very least 10 years he's been on gout medication. They just discovered, guess what he doesn't have? And the first American that has that happen, where they're given gout medication for 10 years and find out, actually, it turns out you didn't have gout all along.
Right.
Misdiagnoses or the things. Now, I do want to address something in Medicaid expansion, and we covered this a little bit with some of our legislators. Mick Mulvaney said to Virginia, we're going to be addressing the out-of-control expansion in these costs. We've already seen the federal budget trimming back on other state aid bags of money, and basically told Virginia's General Assembly, you can expand Medicaid if you want. Don't expect the 90% of it that the federal government was promising to give. Is that important for Virginia's legislature to know that at some point that number could even, I can envision a day where it'll vanish?
Right, exactly. And when the Medicaid expansion came in and under that the June 2012 U.S. Supreme Court decision, one of the things that was good about it was that it was ruled that the states could not be forced to expand their Medicaid programs, and 31 states have expanded. But I think that the amount of money the feds would put into it, first they were covering 100% of the expansion cost, and it's declining. So it's very important for Virginia to realize that it's a declining amount of money. And as you say, as the budget gets more and more out of control at the federal level, it's not out of the imagination to think that these Medicaid expansion funds could be totally removed, and it puts more pressure on a state budget such as Virginia or California, particularly the big states, New York, that have huge Medicaid budgets and huge Medicaid expenses.
Absolutely. And then do you take that money away from law enforcement? Do you take it away from education? Do you drive businesses away with higher? Yeah, exactly. Sally, thank you so much. And again, it's Pacific Research Institute, PRI.org. PacificResearch.org. And just plug, my new book was out yesterday from Encounter Books called The False Promise of Single-Payer Healthcare, and it's on Amazon. So I'm sorry, I missed that part of the preparation, and bad on me. Remind us the name of the book again. It's
called The False Promise of Single-Payer Healthcare, and it's published by Encounter Books. It's on Amazon. And I look at the VA, I look at the Canadian system, I look at the British system, and show all the disasters of what it means when government fully takes over the healthcare system.
Well, God bless you. Is it available for Kindle download and all of the digital plus hardcover copies?
I hope so, yes. Yeah, it should be. If not, it will be.
Put it on your summer beach reading list, if not before then. Sally, thank you so much again. PacificResearch.org. Thank you so much, and you have a wonderful weekend. Thanks for joining us.
Thank you, Joe. Bye.
Delegate Nick Freitas next on Freedom and Prosperity Radio. Next on Freedom and Prosperity Radio, there's this thing, it's called YouTube. You may have heard of it. It's owned by Google, and you share videos on it, like videos of the Virginia General Assembly, specifically Delegate Nick Freitas.
Some of the other things that we would look at, and some of the things I would hope we would have bipartisan support for. All of us agree that we need to make sure that our students are better protected when they go to schools. One of the things that we would look at is arming certain teachers. Not every teacher, but a teacher that is comfortable with it, is former law enforcement, is former military, that is now in the classroom. Delegate Plum said yesterday that that was ridiculous to consider. Why? Is it because the other side of this debate will only accept one quote-unquote solution to this problem, and that is tearing apart or gutting the Second Amendment? And I understand, we're going to mention just a couple of the bills that were done this year, right? Background checks, getting rid of bump stocks. If you're wondering the other reason why we can't have an honest debate over this one is because, quite frankly, I don't think any of us on this side of the aisle believe you when you say that's all you want to do. It'll be bump stocks, it'll be background checks, then it'll be different kind of background checks that register the guns. Then after that, it'll be we need to ban assault weapons. What's an assault weapon? Something that looks scary. Then after that, it'll be semi-automatic rifles. After that, it'll be semi-automatic handguns. Then it'll be revolvers, shotguns. Because when the policies fail to produce the results you are promising to your constituents, you'll be back with more reasons on why we've got to infringe on Second Amendment rights. The other reason why it's really difficult to have an honest and open debate about this is because of this, members of this body comparing members on this side of the aisle to Nazis. Members on the other side of the aisle saying that when a 24-year-old teacher gets up and says that the whole debate is between the Second Amendment or her life, that's a false dilemma. And quite frankly, one of the ones that I found the most offensive, along with being compared to Nazis, was being compared to segregationists. I just want to remind everyone very quickly. It was not our party that supported slavery, that fought women's suffrage, that rounded up tens of thousands of Asian Americans and put them in concentration camps, that supported Jim Crow, that supported segregation, or supported mass resistance. That wasn't our party. That was the Democrat Party. Now, I'm thrilled that Democrats no longer believe that, and I don't believe that a single current member of this body who is a Democrat ever believe those things, but I would really appreciate it if every time you want to make a powerful point, you don't project the sins, the atrocities, and the injustices that the Democratic Party perpetrated on others onto us. So if we want to have an open and honest debate, I am all for that. Let's do that. But it does start with a certain degree of mutual respect. It starts with a certain degree of not assuming that the only reason why we believe in the Second Amendment is because the NRA paid us off. Well, if that's the sort of logic you want to use, why don't you go take a look at how much money the NRA spends and how much money Planned Parenthood spends? Because when I get up here and I talk about abortion, I don't assume that you're all bought and paid for by Planned Parenthood. I don't assume you're horrible people because I disagree with you on a policy position. I assume you have deep convictions so that we can have an argument and a debate about it.
It's burning through the internet. It's one of the most shared things out there, getting millions of views. And he's going to be addressing the Tuesday morning group coalition meeting this Tuesday at the Westwood Club in Richmond. Find out more at our website, virginiainstitute.org or tertiumquids.org. He'll be addressing the Tuesday morning group coalition meeting along with many other great speakers as well. Find out more at tertiumquids.org or virginiainstitute.org. I say this to Nick Freitas with all I can muster in my own humility. A lot of what I watched in a speech, I'm sitting there thinking, gosh, I wish I said it that way. He's Delegate Nick Freitas. How are you doing, sir?
Doing great, Joe. How are you?
Excellent. Representing the 30th district up Culpeper and in there. And you were on with us last week to talk about the Medicaid expansion. And then people started filling my inbox with saying, is this the same guy you talked to? And I hadn't seen you should have told us you were going to make that speech. We would have all tuned in and watched it live.
Well, I wasn't necessarily sure when and where I was going to. I knew I wanted to speak about the Second Amendment and obviously everything that's been going on in the country right now. But the specifics of what I was going to say and how I was going to say it, I really didn't work out until I was saying it. So.
Well, I tell you, if I once I lose my last good marble, if I can't convince my daughter to take over the show like a family business, you're hired, because that was.
Thanks, Joe.
It was brilliant in the fact that it calls out all the things that I think become impediments to actually representing our constituents. And I grasp at, and I am and have been a member of the Republican Party. I have at one point been a member of a Democratic Party. I grew up in New York. It was hard not to be. But I think gone are those days where that's just who you like or who you don't like. I remember the time when Ed Koch ran as the Republican and the Democrat for mayor of New York. The parties have become so partisan that it seems like that having an honest debate about keeping kids safe in the schools, which should be an easy thing for everybody to find common ground about, has become a landmine field. Nick, how do we get past that?
Well, I think part of the problem is look, there's a lot of Democrats out there that I do not agree with respect to their position on the Second Amendment and perhaps even on some of their positions with respect to school safety, who do genuinely want to talk about this and are willing to go beyond, just one or two issues. The problem is that we've got other people that take, I think, an ambulance-chasing approach to legislation. And that is that, they have an objective, and for some people that objective is to significantly reduce or remove the Second Amendment. And when there's a tragedy, that ends up becoming what they put out front as the excuse for why we've got to gut the Second Amendment. And the problem is that as we look at this issue and as we look at other issues surrounding it, you have to take a comprehensive look. And if you're not doing that, one of the things I tried to explain to someone is we get in a lot of debates down here in Richmond about a variety of topics where there's the trade-off debate, right? Liberty versus security. And I'm a liberty guy, and that's where I start with in every single debate. And people look at this as, well, this is another liberty versus security debate, and you just don't want kids to be secure, and it's clear that we need them to be secure. And it's like, okay, wait. First of all, yeah, every debate has that component. But no, in this case, it's also a question of what is the best way to provide security. Mm-hmm. And unless you're willing to look at all of the various factors that go into play here, and I really think the Parkland demonstrates that there are significant problems that we had with the breakdowns and communication between federal and local law enforcement. That was significant. Those are things that we can address right now without controversy. But instead, everything gets pushed toward guns, and that doesn't make our kids safer when we are completely unwilling to touch the 5, 6, 7 things that we could actually address right now with bipartisan support, because some people don't want to miss their chance to gut the Second Amendment.
We mentioned yesterday we were visiting with a columnist from the Manhattan Institute, Max Eden, who wrote a beautiful column about some of the federal mandate programs regarding stopping the school-to-jail pipeline, I think is what the administration called it, that Broward County actually was one of the counties singled out in this for having a high rate of police interactions with students, and then all of a sudden it started to go down, and there are rumblings that this was one of those don't ask, don't tell. However, your speech points out that the shooter in Broward County had been brought to the attention of the FBI 30 times, and I know that Bob Goodlatte and Trey Gowdy heard from the FBI assistant director on this, but yet it doesn't seem like they asked this director what in those 30 times made them not go the next step and contact the local authorities, or did they, and what was the response? See, those are the kind of fixes I think you're talking about.
Well, absolutely that, and it's about also addressing that, again, when all of their mass shootings are taking place in gun-free zones, we have to take a look at the efficacy of that policy. I think the other thing that has been really frustrating for many of us is that anytime we talk about, look, there may be a route here to arm certain teachers, again, former law enforcement personnel, former military personnel that are now in the classroom. We could take them through additional training. And as soon as we say that, Democrats come back with, oh, now you want to arm, every teacher out there, and they don't want to do that. Mm-hmm. And they parade out a bunch of teachers that say, I wouldn't feel comfortable with that. And I feel like, okay, this is intellectually dishonest. We never said arm every single teacher. But what people need to understand is that if you do have, maybe one teacher in the school, former law enforcement, former military. We have a great program that helps veterans transfer from the military into teaching positions. If that person went through a proper training program, was concealed carry, his students never knew he was concealed carry or she was concealed carry. What it does, though, is it sends the message to anybody that would shoot up these schools that now there's an unknown factor that they have to contend with. Now, when they walk onto that campus, they have no idea if, I may be walking into an environment where someone's going to be able to stop me right away. Because let's face it, these mass shooters are largely cowards. They look for soft targets. And doing little things like that actually does have an impact. It does serve a deterrence factor. So I think that when we look at that, when we look at various things that we can do, there was a student that came up with an incredible device in shop class where you can put it right underneath the door, you turn a knob real quick, and all of a sudden nobody can get through the door. Mm-hmm. And there's all kinds of solutions that we can be working on. There's funding mechanisms that we can make available for this, but until we're willing to have that open and honest debate, and again, I think that the Speaker Cox is trying to do that now with this select committee. It's the first time that we've had a select committee in the House since the Civil War. So we're taking this problem very, very seriously in Virginia, and we're actually coming up with mechanisms. And we did so last year as well. We passed a piece of legislation that would allow schools to be able to get more security guards from retired police officers who had already been trained and qualified to carry a firearm, maybe former school resource officers that could augment our current contingent of school resource officers. So we've done things in Virginia. We're continuing to do things in Virginia, but right now we really need to focus on those areas where there's bipartisan support so we can get that legislation done, out the door, and actually make a difference.
Delegate Nick Freitas is on with us. Yes, that Delegate Nick Freitas of the YouTube video that's going everywhere. And I'm sure at some point I'm going to have to get in line behind Sean Hannity and Lars Larson to talk to you. But let me ask you this, and I don't know if you're on the select committee or not. I would hope you are, but if not, I know that I see one name from our own local representative lineup, and he's actually the guy who introduced me to you the first time when Delegate Scott was retiring, and I was concerned about losing a good conservative voice, and he said, "No, let me introduce you to Nick." Rob Bell, who has written some of the most artful legislation to come out of the Virginia General Assembly since Jefferson and Madison left, especially in the light of first time I met Rob was right after the Sung Wee Cho massacre at Virginia Tech, and they were coming up with better ways for the mental health care industry to work with law enforcement to help people get the help they need when they need it, and not fall through these massive cracks that fall in the system. And even Cree Deeds has been a leader in that as well. And even in these cases, if we demagogue the gun, don't we lose the opportunity to come up with ways where that, as I pointed out, the troubled 11-year-old doesn't become an angry 19-year-old with a rifle?
Absolutely. And the more that, and quite frankly, the more that some people within, again, not all Democrats, there's some activists that have done this. There's a lot of Democrats, a lot more Democrats that just want to sit down and have a solution, have a useful talk. But there are some Democrats that have got out there. They have whipped up a bunch of students into a frenzy who had never thought about this issue before, or who had never done deep analysis of this issue, and they're pushing them out front, and quite frankly, they're exploiting victims. Yeah, and it's very frustrating. So understanding that we have people like Rob Bell, that we have people like Democrats Mike Mullen from Williamsburg, that we have people like that on this select committee who are going to sit down, they're going to look at data, they're going to look at facts and evidence, they're going to come to, they're going to offer recommendations based off of what they found, completely understanding that there's going to be different approaches in different parts of the state. Lee County, Virginia, may have different solutions to this problem than Alexandria, and that's perfectly appropriate. But there will be some common components to school security that I think the select committee is going to be able to assist with across the board. But that's what we need. We absolutely need cooler heads to prevail, to come to the table, to find, again, those issues, and there are several of which there are bipartisan support. We can do that right now. Let's do it. But that's going to be harder to do when we're sitting there and we're throwing barbs and arrows at each other, especially because we have certain people that look at every single tragedy as an opportunity to take out the Second Amendment.
There was a campaign, and I don't want to make it personal because the gentleman went through tragedy. He now serves with you in the House of Delegates, but we did the math, spent about $1,100 per vote to win the seat in the Virginia House of Delegates down in the Roanoke area, and that money comes from somewhere, and it comes from people who want to ban guns for whatever reason. Sometimes they used to be mayors of big cities, Michael Bloomberg, who, for whatever reason, seem like that's the panacea, and I worry that the money is going to taint this, Nick. The Virginia way is something you hear an awful lot bandied about in political circles, and usually that avoids this political intrigue of big bucks being thrown at this. Can we avoid that? Do you think cooler heads can avoid the money that could be thrown at delegates, especially with an election coming up again next year?
Well, elections have consequences. And unfortunately, the message that I think some of our colleagues got this last election cycle was that a lot of money thrown at these elections, and then a far more liberal, progressive, in some case socialist approach is what, unfortunately, people of Virginia are going to get. And I think a lot of them did not bargain for that when they went to the polls this last November. So I hope it does. I think we've got enough people on both sides of the aisle that certainly want the Virginia way to prevail. But we're also adamant that, part of the Virginia way that I like to remind people is, we believe in individual liberty. We believe in property rights. We believe in equal justice before the law. I mean, Virginia holds a special place in this country's history, and therefore we have a special responsibility to preserve those things as we're seeking policy solutions. And so I think if we can remember that while we go forward and understand what a serious issue this is, and that people have a right to see answers from their legislators, where there is an appropriate legislative component, then I think we get the right people around the table and we get some things out the door. There's still going to be some disagreements, but I think we can keep it civil.
Nick, one of my favorite parts of your speech on the floor last week was where you started to talk about all the places in the world, and having served in the military, you've seen a lot of these places where the government insists that they should be the ones for your security, and then whether it's you're in the wrong team or not, or you're not friends with the right guy, they turn on you. And a lot of the third world countries, we see this, but even in what are considered not third world countries like South Africa, where property rights have just been torn up and torn out of their constitution. That rumbling you hear, maybe Nelson Mandela spinning in his grave. I don't know. But these are the kind of things that kind of thuggery, you brought it to the fore beautifully, and we could easily go that way if we're not careful.
Well, I think that, again, the problem is people have this idea that it can never happen here. And I don't think we're anywhere close to an environment where our governments would start to do things that we've seen other governments do, whether it was in the 20th century, even what we see right now going on in South Africa and other places. But we need to understand that part of the reason why is because when citizenry are permitted to be able to defend themselves, that has a psychological effect on society as a whole. It has a psychological effect to remind government that ultimately they're there to serve the people. And when we have completely ceded over our right to self-defense to the government and made ourselves completely dependent upon the government for that security, don't be surprised when hubris and arrogance gets the best of politicians, maybe even well-meaning politicians, and they start to abuse their power. We see it all the time at a lesser level, but that's still an important one. We just had people the other day on the floor arguing that the government had to force you to buy insurance programs that you wouldn't normally buy because they honestly believed it was the position of the government to manage the insurance markets in that capacity.
Mm-hmm. Yeah.
I'm sitting here in my chair just dumbfounded by the fact that we actually have politicians that think that is their role, to force you to get things that you don't want to get, or to force you to buy plans that you wouldn't otherwise want, in order to micromanage the economy in that sector. Well, that's the sort of hubris that when it becomes completely unbridled, right? And again, I don't think we have a lot of people that are there yet. But when that kind of hubris becomes unbridled, that's when you once again remember why it's important that the government understands that its primary responsibility is to serve the people, again, protect their liberty, provide equal justice before the law, protect their property.
Yeah.
So, again, if we ever lose sight of that, we're going to, and if we ever think that we're so enlightened that we can never once again be in a position where the government can pose a threat against people or a particular people group in this country, then I would say that we've dabbled in a level of arrogance that has brought down other countries as well.
Do you think that next session, obviously most of the stuff will come into the next General Assembly session because none of it really moved forward here? They tried to use Charlottesville August 12th as a fulcrum and it didn't work. But maybe, do you think because with the looming elections and it always seems to be the flaming rhetoric gets a little ramped up as elections get closer, that next year we could see an awful lot of this come forth?
Yeah, unfortunately, I think we will with respect to rhetoric. I mean, my goal was to get us more to analysis as opposed to demagoguery. But we'll see what happens when you have an election every year in Virginia. Sometimes it's difficult to have a calm, cool-headed policy debate without campaign rhetoric moving into it. But again, part of that is on the candidates. I have an obligation to ensure that when I talk about this issue, I bring up my concerns, but then I also offer solutions, and we're going to be doing that. So again, that's the goal, and I think we have the people to be able to achieve that, and we'll continue forward.
Well, and I know that some of the great learned issue-oriented rhetoric that came up after your speech was, he's just running for Senate, which I thought was funny because here we go again, not debating it on the merits of any of the points you made, but just dismissing it out of hand as something less than it was. And it's sad because if you do that the other side, then you're closed-minded and you don't want to have a debate. Nick, well, I appreciate everything you do for the Second Amendment. As I said yesterday, if there was only a list of rules we could follow, like don't lie, don't murder, don't covet your neighbor's wife. If there was only a list like that, we could talk about. But I appreciate everything you do, and good luck down the trail. And we'll talk to you again maybe next Friday if you do something else that winds up on YouTube.
Sounds good. Thank you, Joe.
Delegate Nick Freitas, nickforsenate.com is his website as well, and tertiumquids.org if you want to be part of the Tuesday morning group coalition meeting this coming Tuesday, the 13th, 10 a.m. till noon at the Westwood Club with the Virginia Institute for Public Policy. For all of us here, I'm Joe Thomas. Until next week, so long, and thanks for all the fish.